Broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the December 2018 Pre-Hospital Care Research Forum Educational Research Journal Club podcast. The Pre-Hospital Care Research Forum is dedicated to the promotion, education, and dissemination of pre-hospital research. We believe that it is the responsibility of emergency medical professionals worldwide to build a body of evidence to examine pre-hospital emergency care. The PCRF partners with the National Association of EMS Educators to promote research literacy and advance the science of EMS educational research. Here with the PCRF Journal Club, we take a closer look at some of the latest research in medical education. I'm Megan Corey, and I'm here with Dr. Bill Toon, and Sean Britton should be joining us as well. The study we'll be reviewing today is entitled EMS Providers Do Not Use Foam for Education. This was published in the International Journal of Emergency Medicine in 2018. We're also joined today by the primary author, Dr. Joshua Bucher, who can help us navigate through the study from the researcher's perspective and answer questions from listeners. Now, this review is paired with an article in EMS World called Research Alert, a review of original medical education research, and we encourage listeners to check out this article at emsworld.com under the category of education and training. Thank you all for joining us today. So let's begin, and we want to remind our listeners that you can use the chat feature on your screen to type in questions and comments, and we will bring those into the conversation as we go. Now, a little bit of background. Free open access medical education, or Meducation, is exactly that, accessible free medical education that's presented in a variety of forms like blogs and online articles, videos, social media posts, tweets, podcasts like this, and even journals with original research articles like the one we're reviewing today. Links can include referenced and unreferenced sources, so it's often controversial, but it's globally accessible and crowdsourced. Now, educators, particularly online and distance educators, have used foam to supplement traditional education practices. Supporters will say that textbooks can be cost prohibitive and pose a needless barrier to accessible education. But on the other hand, there's also concerns over quality and propagation of inaccurate or even dangerous practices through immediately accessible online resources like this. Whatever the case, foam is prominent in medical education among emergency and critical care physicians and in residency programs for a decade or so, with an explosion of content and the creation of the Twitter hashtag, hashtag foam, hashtag foamed, hashtag foam EMS, and the list goes on. So as EMS providers and educators, where do we stand on foam? Well, there have been several articles in EMS online world. I know of a few from sites like Life in the Fast Lane that review the history and provide some tips for EMS professionals on how to access and interpret sources. But compared to the reach and the integration of foam into emergency medicine and critical care, we really don't know a lot about the use among EMS professionals. Now, there was another article that was recently published in the Journal of Education and Health Promotion, and that was by Mason and Batt. And Alan Batt has known for several research articles on the use of foam in EMS providers. And this was on the hashtag foam EMS tweet contents between 2014 and 2017. They found that over half of the top 92 tweeters were paramedics, and that the contents were most commonly related to, not surprisingly, cardiac and EKG, but kind of surprisingly, leadership and education, and then finally trauma. And earlier in 2016, an NAEMSP abstract from research at the University of Pittsburgh showed that the majority of the 400 or so EMS providers they surveyed maintained social media accounts, and that over 85% of them used online medical education, but that this was mostly limited to the state-based continuing education learning management system. So keep in mind that these studies would also have a selection bias, and we talk about research on this podcast, but these two would have a selection bias since one was already looking at those who had already accessed social media and in the use of Twitter and the hashtag FoamEMS tweets. So they were looking at contents, and these were already people accessing social media. And the other surveyed state conference attendees. But what about the overall population of EMS professionals? So that's why this study caught my interest and our interest at the PCRF, which is the study is that from the Department of Emergency Medicine at Rutgers. And they aim to evaluate the use of social media and foam by EMS providers at large. So I'd like to bring in the primary author at this point, and this is Dr. Josh Bucher. Thank you for joining us today. And if you could you begin by just introducing yourself, where you're from, and then just how you came about this topic for research?
Sure, and thanks for inviting me on. I am a assistant professor at Rutgers Robert Wood Johnson Medical School. I'm also the EMS medical director for the Robert Wood Johnson University Hospital's mobile health services. And I've been involved in EMS basically since high school. Ironically, I wanted to get a raise on my job as a lifeguard, so I became a volunteer EMT and then actually liked it. And that actually turned my entire course down for my career into medicine. I wasn't planning on it at that point. And so here we are now, 15 years later, and I have been embracing the use of foam for residency education. I also do a lot of education for our emergency medicine residency, and that's kind of what got me interested in for EMS, because in EMS, we also, obviously, education is really important, and the overlaps between emergency medicine and EMS is, it's very similar curriculum. And I figured that there should be more interest in the general population of EMS providers than there is, and I wanted to see exactly how many people were using it as for an educational tool for EMS.
So what years were you then in your residency program?
So I started, it was 2012 through 2015, and I left in 2015 to do an EMS fellowship, and then came back to faculty in 2016. So I've been full-time there since then.
So you were at the advent of the foam kind of movement in emergency medicine, right? I think I read somewhere that, and I don't know how true it is, that the terms, at least foam, was first coined in a pub in Dublin in 2012. I don't know if that's true, but and then a hashtag wasn't created until 2014 or somewhere around there.
I have heard the same story, so I was chief resident my last year of residency, and I had started to incorporate more aspects of foam into our resident didactics, and since then it's continuously gotten more inclusive of foam. So I kind of started and ended residency while foam was starting to pick up, and obviously now it's much more popular than it was back then and much more widely circulated.
So had you interacted with EMS providers then in your area and been surprised at the lack of familiarity with it, or what brought you to say EMS providers need to be familiar with this?
Yeah, that's exactly what it was. We would talk after they'd bring patients in, or they would have questions, and I would direct them to these resources, and they had no idea that some of this stuff existed online and was free and easily accessible.
That's very cool. So why don't you take me through then why you chose this methodology, and you have this question that's pretty clear. You wanted to evaluate use of social media and foam use by the EMS provider. So what drove you to use the online survey and go through the American College of Emergency Physicians listserv?
So the online survey, we figured that it's much easier to do online surveys than paper surveys, obviously, because they can be sent out further, and it's all done electronically. And when you keep things short, within span of obviously less than 10, but less than 5 minutes would be ideal, people are more likely to actually respond to them. The ASAP EMS Medical Director listserv is a pretty big listserv with hundreds of physicians on it who serve in leadership roles in their departments throughout the country. And I figured that would be the easiest way to try to disseminate this survey to as many medical directors as possible, who could then send it out to their agency.
Okay, and so walk me through then the time period and how you started doing this.
So we sent out the email. We sent out an email after everything was approved by the IRB. Sent out an email on the listserv, and I believe I repeated the email 2 or 3 times over the course of 1 to 2 months to try to get as many respondents as possible. And at that point, I'd also asked anybody who sent it out to their agency to just send me a quick email with the number of providers in your agency so I could calculate a response rate. So I didn't get as much response as I would have liked. We only got around 100 and change, so 169 respondents. And of the medical directors who emailed me back, there was a total of 523 potential providers who would be answering it.
Okay. And, Bill, can you jump in here for a second, too, in your experience with reviewing survey research, and what do you like to see? And Dr. Bucher, you can also comment. At what point do you say, okay, this is what I'm going to get, and that's all there is to it, or maybe I can try for more, or when are we satisfied and say this probably isn't something I want to use?
Yeah,
yeah. Go ahead, Doctor.
I just picked 2 months kind of arbitrarily. I figured that nobody else was going to be sending it out after that amount of time.
Oh, that's interesting. Mm-hmm.
Yeah, they and so I do not have. When you look at how commercial businesses do surveys, they incentivize their surveys. And when you can incentivize your survey, you can often increase your response pool to your survey. And then in this case here, you have to think he was asking the good nature of busy people to send it on to their particular agencies. And then someone in their agency takes the time that works for the medical director to send them out. So I think it still was a logical way to try to capture a large audience to get them to participate in. But I think that when you look at survey work that it's done, 2 months is really a healthy long time to get response with a follow-up. But I think that you will find in general, most surveys are done even in a lesser period of time. Now, of course, my wife, who does survey work all the time, might have a different opinion, but I think she keeps most of her stuff under 30 days for the work that she does.
And I would
have loved, I would have loved to been able to incentivize it, but I don't have the research funding I would need to do so.
And herein lies another podcast, right? So I'm always confused, though, when should I feel like, okay, that's a decent response rate? Because a response rate is one thing, and I guess it depends upon the population that I'm going for as well. I don't expect a huge response rate, frankly, from most of your line workers, unless it's part of a required educational piece and they have to turn in a survey in order to get continuing education or something like that. But when should I look at, when I'm reading research and I'm looking at the response rate, when should I say, well, that's probably still sufficient?
That's a great question. I know what a good response rate is. Typically, you're looking for greater than 80%. So this falls obviously well below that number. Mm-hmm. I don't know if the results are less valid because even with the low response rate we had, it wasn't really a self-selected group that they all said, "Oh, I love foam," because in the results, the majority of people did not use foam at all. So even though the response rate's low, I'm not sure it introduced a ton of bias in the results.
Yeah, you might argue that the people who use foam could be more likely to be the ones to use SurveyMonkey and answer your
Exactly.
survey. One of the ways I know that we've looked at, and we've talked about that in this podcast, to look at whether or not you've got an adequate representation is to compare to the overall population, things that might influence your overall results. So we have a few things here, and that's what figures 1, 2, and 3 are that we see is not just a description of the population, but also maybe a description of the population as to whether or not that might influence their likelihood that they would answer in a particular way. So if you can walk us through some of the things that you looked at in terms of some of the questions that are in these figures?
Sure. So, region of the country is pretty self-explanatory. And it does seem to be a little bit geared towards the Northeast. I'm not 100% sure why that is, as opposed to the other regions, but that was the results that we got. I think in figure 3, where you see the type of system, that seems to be a pretty accurate makeup of the country. Maybe there's a little bit more in the urban response, but this seems to be pretty representative. And then in figure 2, with additional degrees, we didn't have anybody who reported a doctorate or PA, but a decent number of the respondents held a bachelor's degree, which probably makes sense when looking at the EMS community as a whole.
Yeah, and maybe the EMS community in the Northeast as well. That might be also a regional representation. Interestingly, just a comment on that article that I mentioned before, the one that's in the Journal of Education and Health Promotion, there is a map in it on the location of their EMS, of their tweets, of the foam EMS tweets during October of 2015 in one of their figures. And it's pretty much, you have dots all over the world, but you have a distinct cluster in the Northeast, which I thought was interesting. I thought, well, that's interesting. You have this big cluster in the Northeast here, and your representation from the survey is from the Northeast. So I don't know if that means anything, but I don't know if it's more engagement and by medical directors themselves or whatever. But well, those were EMS tweets, so and paramedics. So that's interesting.
That is unusual, yeah.
Yeah. So we have, do you hold degrees, what region, and then what type of system do you currently work in? Are there other things, what other factors might influence the outcomes of the survey response that weren't included that you would have liked to have measured?
I'm just trying to think of, so.
I mean, I thought of like people currently in school, if there were people that were actually currently in a paramedic program or an EMS program of some kind, or they're currently a student, they might be more likely to, be experiencing exposure to foam.
That is an interesting idea, because I teach for one of the paramedic programs in New Jersey, and they do seem to be, at least some of them seem to be very interested in foam and actually are already following different websites and different blogs that have been around for the emergency medicine community for a long time. I'm not sure what else I would measure, although measuring students is, I guess, a different group than current providers.
Yeah, and I'm trying to think of what other things, Bill or Sean, I know Sean Britton is on as well. Are there other things that you can think of that you might want to look at if you're doing a survey? Because personally, I think that this would be a great survey to do for EMS educators. I would love to know the same results for people that are actually right now in classrooms and, and clinical settings and field settings with EMS students from EMT level, actually from first responder level all the way through. I'd love to know what their response to these surveys are. So
I would be interested in some more demographic information. So that would give you the ability to do some sub-analysis. Gender would be a good one to know.
I think you had gender. Did you have gender on this? I thought it just said the majority were male, I thought.
I believe I had gender.
Yeah.
I can actually.
But I'm just saying, gender's good. Level of EMS credential is I think is always good to, just in general. I'm talking about with surveys if I'm looking for stuff. But I think that's really good to have an appreciation for that. And then how many years they're in the business, how many years they're in the service. Are you looking at newer, younger? That's where age comes into play, but then years of experience, because I think that you may find, and this is an opinion, that it could be more geared towards the younger generation of providers, those that are in their late teens, early 20s, that may be more into the technology aspects of accessing information. So those would be just some additional interesting demographic type of stuff I'd like to know.
Yeah.
And then the type of delivery model, are they hospital-based, fire-based, those typical type of things that really helps you understand that population, and then lets you do a little comparison to other generalized surveys that are out there. Like if you wanted to look at the lead stuff and say, okay, how does this group that answered this survey compare to the people that answers the lead survey on a regular basis?
And some of the stuff is actually in the results. It's not in the figures, but 81% of respondents were male. I'm not sure. I'd have to look at the practice analysis and see if that's if it's the same, as the national breakdown. I know, it's predominantly male still, but I don't know if it's 81% might be more than what the national average is. The mean age of the respondents was 39 years with an average of 17 years of experience per provider. So that, was age a factor? We don't really know, but that mean age being 39, average of 17 years, it would be interesting to know the age of the respondents. 53% of the respondents are paramedics, 37% EMT basic trained, and the remainder, 16%, are distributed between the remaining options. 81% involved in paid EMS, and then the majority, 52%, in a suburban practice environment. So that's reported in the results, and those are some of the demographics that you mentioned.
Yeah, now you can take some of that, though, as you said right there, and you can look at the practice analysis, and this lets you take, I think, then this survey and say, okay, is it representative of our greater population? And then you can draw some more generalizable information after this. But my gut feeling is what is it there in the conclusion, regarding the use of foam by EMS.
And the next line in the results says the minority of respondents had heard of the specific phrase foam, which was 20%, 20.4% had heard of that specific phrase. I have to say, I did not know of that. I was probably utilizing the sources without really realizing that phrase for some time. And I think that might be the case. It did say, however, 53.6% had heard of free medical education online about topics related to EMS. And then we're talking about, the breakdown after that. And actually, can you advance the slide to figure 4? So this is how frequently you use free open. And what did you make out of this? Was this surprising to you?
No. Well, the amount of people who do not use was surprising. It was very high. I was hoping to see that EMS, there was more foam in EMS. But the other breakdown looks relatively, understandable. For someone like myself, I'm not going every single day to blogs and podcasts. We do have jobs, we have other responsibilities, we have children. So for that reason alone, not everybody does daily, weekly, maybe once a week is okay. So that breakdown is all right, besides the fact that there were so many people who just did not use it at all.
Yeah, and then this is the rates of using foam resources.
Yeah, so surprisingly, Facebook was the most, and I'm going to make an assumption here, but I'm going to guess that it's from the sharing of resources on Facebook, because there's not a lot of, foam that's actually primarily published on Facebook. It's more just disseminated. The two main things would be blogs and podcasts, and then it's all disseminated on Facebook and Twitter. So I'm assuming that's where that came from.
Yeah, and Twitter, I would think, are links to articles, links to other resources as well.
Yeah, Twitter is very big in the emergency medicine foam world in terms of sharing and tweeting and responding to each other and having discussions online. Twitter is probably the most predominant social network that's used.
And then assigning the hashtag as well.
Yes.
Sean, are you there? I see you're muted, but can you unmute? I see him, but he can't seem to unmute. I was curious about his use because I know he's recently become involved in... Oh, Sean, you're there. Can you hear me?
I'm here now. Thank you.
Yeah, you were recently teaching EMTs, so or advanced EMTs, I think we were talking about that. recently. What's your take on all of this? Have you used these resources in education or others? What about your class?
I have, and it's a great way as an educator to keep current. And something I wonder about that would have been interesting to have within the survey is I wonder amongst the respondents whether they're accessing non-foam resources, the traditional peer-reviewed research. Because what I'm kind of wondering in this whole group is the people who are utilizing foam, are they utilizing it by itself and they otherwise would not have accessed peer-reviewed research, or are they using it as a supplement to the peer-reviewed research and potentially a way to pursue which articles they're going to read in full? I'd be very interested to know if it's supplementing what people are already doing or bringing resources to a group that otherwise would not have been actively engaging with the larger emerging literature out there.
Yeah,
that would be a good question.
That's a great question. Also, are these, since this is, paramedics and EMS providers at large, are they using this for, we're talking about people that are on the ambulance working. So if there's a difference between, I'm in school and I'm accessing these things because I need something to supplement this textbook, or I don't understand something in the textbook or something else that's been said in class and I want to look it up, or someone told me this and I want to see if it's true. Somebody who's in class versus somebody who's sitting on the ambulance and saying, look at this cool EKG that I saw on this blog and, check it out and look at, pass it around and see if anybody can, determine what's going on. And what are the uses for the different types of, whether they're students or whether they're interns? Because that's what I thought was so unique about this study itself, is that we're looking at at people who are practicing. Whereas I think, and maybe you can help me with this, Dr. Bucher, I think that most of the resources in foam in the medical, emergency medicine and critical care are in the area of residency training or medical training. But has there been a lot done on, does this include people that are just out there practicing?
There's definitely a lot geared towards people who are practicing. So you can find in all of it exactly what you're looking for. There's plenty of foam that deals with the bread and butter topics. And then there's plenty of foam that deals with the cutting edge, controversial, research paper, critical, critiquing, big research papers that come out that are important for what we're doing. So there's definitely the spectrum of everything.
Okay, because that's one of the, I usually write in my little columns here on the paper, and I was saying this would be great as a survey for EMS educators, as I mentioned before. Like, what about, in the discussion you talked about the unfamiliarity of this resource by EMS providers being alarming, and then I thought, well, what about interns and educators, the people that are actually learning out there? Because to me, it should be higher, that using resources like this. And I think because, if anything, I think the students usually are the ones who have brought it to light to the EMS educators. And that's has no basis in research. That's just my observation as an educator, that the students have come to me and said, oh, I've been listening to this podcast, or I read this blog, or, and this is what we read or heard. And so it brought me to learn about certain podcasts and blogs. So I'm really interested in how much our interns and paramedic students and the educators, more importantly probably the educators, engaged and using these resources.
Yeah, I agree. In my experience, both as a student when I started, it's often from the bottom up where this comes from. For whatever reason, I'm not entirely sure, but it often comes from the bottom up. So it's the students who are reading the blogs and podcasts about the cutting edge controversial topics, and then mentioning that to their preceptors.
Yeah, exactly. And can you forward the slide to the appendix, because there was a list also of And this was the list that was included. The item was, please list any specific free open education access resources that you use, or hashtag foam resources that you use. And there were 37 total answers, and these were the most common ones that were mentioned. So, of the people that responded to the survey, these are the sites that were mentioned. And I can think of a few more just looking at this that have come up maybe since then, or maybe more in the education realm.
Yeah,
Megan.
Oh, go ahead.
No, I'm sorry. Please go ahead.
This was the most common ones that were cited. Obviously, things like YouTube, Reddit, iTunes are not particularly specific, but iTunes, makes sense with podcasts that make it easy to subscribe. And then YouTube and Reddit are, YouTube with videos. I know of Reddit. I don't use Reddit at all.
Yeah.
So I'm not sure what sort of resources are available on Reddit for foam. That was a new one to me.
Yeah, I'm not familiar either. So,
what do you feel, as foam continues to expand and become a more commonplace? How do we know the drive for the quality of what's in foam, and how do you, it's I think this is always going to be when something is free, the saying is you get what you pay for. So how do we self-police, achieve whatever it might be within this environment, in your opinion or from your experience?
Oh, it's on the internet, so it has to be true. Some of the resources now are peer-reviewed. So there's a website called emdocs.net, and they take user submissions for various topics, and every article is reviewed by an editor. So some of the bigger ones are doing that now, and you also can take into the account that these podcasts, these blogs are being peer edited by everybody who's commenting on it. So it's not like these things are released in a enclosed environment like a textbook. Blogs have comment pages, there's forums, there's Twitter. On the podcast, they're often followed by, they are started through a blog, so there's ways to comment on podcasts as well. So everyone who's listening and everyone who's absorbing this information is also in real time editing it and providing feedback. So it's both peer edited and peer reviewed.
What's really difficult as an educator, I was just thinking about this a little, is what happens when it's all true? What happens when you have two credible sources saying something that are both defendable and true, and yet your students at the end of a course have to take an exam, and you don't know the knowledge set of the educator writing the exam? For example, in the course I recently conducted, the students were asking on the test, is it A, B, C, D, E, or is it X, A, B, C, D, E? And the X coming first for exsanguination obviously reflects the latest changes to PHTLS and an evolving idea you have to control bleeding prior to the traditional ABCDE. And as an educator, my answer to the students was, I don't know who wrote the exam. My guess would be the ABCDE because that's more well established. However, we now have newer, more current ways of doing things. So when there's that discrepancy and all these different resources all presenting new information, which is valid, it can be really difficult for the educator to try and distill that to students on what they're actually going to need to know when they're taking that state licensing exam.
That's a great question. I don't really have a great answer for it. My opinion on tests is pretty, I find them useful to an extent. Tests are often 5-10 years behind current practice. They're often based on old guidelines. So for tests, I tell people to answer whatever the textbook says. But in reality, we practice 10 years in the future. So in reality, often what the textbook says is not what we're actually doing. And that you get from home.
Yeah, and that is a challenge because we are now in a period of time where new information is coming out so rapidly. How do we find that strike that correct balance? And when is something so new and novel that's being done, for example, within animal labs or with cadavers, when does that information that's being reported, when should you make the jump and bring it into your practice? And then how do we evaluate that the people have the knowledge and are practicing the way that we want them to? So it's, and I've always disliked that term, answer it is in the textbook, because we're not setting our people up to really be thinkers and stuff. So it's a, Sean brings up a very valid, question is how do we keep them to be striving for the greatest amount of information, but then also have that judgment to say, okay, this is so new that it's not ready for prime time in my practice, but it's something that is going to change practice in the future. It's really, to me, it's an exciting time for us in all of medicine.
It is, and it used to be, I believe that the estimates were 17 years from paper to practice. So the knowledge translation from research. And now we've gotten that down to, 1 week. Something big comes out and all the foam, all the big foam websites and blogs and podcasts talk about it, and suddenly practice can change. That is something that is relatively new in medicine, and there's no great answer on how to do that besides looking at it, making your own decision, and then reading all the comments. That's another great thing about foam, is that while it also reduces that knowledge translation window, it also immediately allows people to provide feedback and saying, this is crazy, we need more research, we can't just change practice because of one article, etc. So it has both sides of the argument.
Yes.
I'm sorry, let me just jump in there. But that, again, is the challenge we face with as EMS providers. EMS providers are not independent practitioners such as yourself. You have a greater latitude. Now, I understand you have to still work within the realms of your peers and how they would judge you for what you do, but EMS providers do not have that kind of latitude and are often governed. For example, if the state has a statewide protocol, it may take them 3 or 4 years to even get the new AHA guidelines into their state protocol. So there's really a difference between the practice of medicine by physicians versus out-of-hospital care providers.
And that's unfortunately true. In New Jersey, EMS is very fragmented. Just briefly, it's ALS is hospital based, but the ALS agencies were given a certificate of need from the state in order to provide services. The state has standing protocols, standing orders that are written into law. They're not even code, they're actually legislated and have not been updated in, God knows how many years because of the state legislature. And then each individual medical director can change certain things as long as they're within the scope of practice for paramedics in New Jersey. Again, also written into law. It's not administrative code, unfortunately. So these things take, 10, 15 years to change. One of the benefits is that since I am the medical director for my agency, I see my medics all the time and my EMTs, and they routinely come to me with things saying, hey, we read about this, we saw this, what are your thoughts on it? Is this something we could potentially do? So it's nice to have that rapport with them, because I'm there, and it's not a statewide protocol that we're following, but we are also somewhat limited because of, it's EMS and it's not medicine exactly, although it should be.
Isn't the other interesting thing about the foam resources that while some present new ways of doing things which would require larger system changes or protocol changes, some of the resources out there are more about practice tips that are within the scope of the provider to utilize. Like if there's a new way to start interpreting ECGs that's more effective or better at spotting certain key criteria, ECG interpretation is already within the provider's scope. So now this resource might enhance what they're able to do without requiring a larger system change. So I think that's kind of another neat aspect to all of this.
Yeah, I was going to say exactly when you first started. Yeah, EKGs being a big one, that it's not new and it's within the scope of practice. It's just that we are getting, as medicine as a whole, we're getting better at recognizing things. Things like Wellens syndrome, which you can find all over the foam world about how to interpret it, and that's a relatively new finding that we're realizing, is a STEMI equivalent. So definitely can help with topics like that.
So let me ask you guys then a question. In the beginning of your article, you cite that the Council of Emergency Medicine Residency Directors, they had released a position statement and guidelines on the use of social media and foam for residency education. Do we need the same thing for EMS education? And if so, who does that come from? Should it come from NAMSP, NEMC, the COA? I feel like that we need some guidance, and that's what might help some of the concerns that Sean and Bill, that you guys are talking about.
That's a great question. I do think that there is a role for it in education. I'm a big proponent of the flipped classroom model, where you have to, just briefly, you have to read the source material before you go to class, and then you use class time to discuss or use some sort of didactics or hands-on. So I really do think that there's a role for foam in EMS education. Who should it come from is a great question, and honestly, it should come from all of the above. This shouldn't be, one agency says we should use it, the other organization says we shouldn't. This really should come from all of the above. I think NREMT has a big role to play as well, being that they design and produce, the national curriculum. So that would be I think that would be the first place to go, but it should be uniformly recognized.
And there's been, I don't know if we've reviewed it yet. Probably not. That's a good idea to actually pull some of the flipped classroom research. There's a couple of very active EMS researchers in Florida and Kentucky and a few other places that are that have some outcomes research on EMT program level, I think in particular. And there's actually a flipped classroom model that's out there already for those who want to adopt it for EMS education at the EMT level, and there's a paramedic one that's being worked on right now. So I completely agree with you that all these programs could incorporate foam into initial training for a number of things. And you mentioned EKG interpretation, critical care patients, and airway management in particular, I think, is with airway cam and other things that are out there. I think that you're exactly right. The other thing is distance education. So utilization of foam in asynchronous or even synchronous distance education, I think is it's called for. One of the things we haven't mentioned is that I can't remember exactly what the number is, but it's something in the high 60%, like 68% this is from the COA EMSP, of paramedic programs are within colleges. And colleges, I know the open education resource movement has been around for a while, and zero textbook cost, the ZTCs and the OER movement, LibreText, make a book for you for free out of open education resources. And this has been going on for some time and has really taken off in distance education to provide more accessible education with quality resources. So I think that that between the both angles, from the college end and from the foam end, that this is really picking up steam. But like Bill said, I think some guidance is probably in order.
It's interesting. This study also kind of alludes to the fact that maybe as educators, when we're teaching, in particular to the affective domain of the student valuing the importance of research and pursuing continuous professional development, the fact that this study shows a very low engagement with foam might indicate that that's something that as educators we need to get our students more trained to do, and to really value the resources that are out there as part of the initial education, but something that carries forward in their continued professional practice.
Yeah.
Yeah. It's lifelong learning is a big aspect in medicine and EMS, and even though we've graduated residency, you finish paramedic class, medicine changes. So lifelong learning is really important in this field.
And once again, I'd really like to know, though, Sean, what would the educators, if you spread this out, not just to the people that are here on this podcast or that attend MC, or I'm talking about all your educators that are interacting, all your lab instructors, and survey them and see what your response rate would be on this. Like mentioned before, sometimes it comes from the students, but I'm wondering what the educator response to students is sometimes. Are educators more, maybe more traditional educators, more likely to say, well, I don't use that and you need to, stick to the textbook? Or do we see educators advancing, in this area and adopting different foam resources, and how?
Sounds like you guys have a good research idea.
Yeah. All right, all you listeners out there.
Yeah, those of you with free time and money. But I think that one of the things you've touched on in here, and again, I want to go back to it, EMS in general is hampered by the fact that we are in a subservient role, and other people, other than the people really working in the street, or even the educators, are dictated how their practice will be, instead of us being truly self-regulated and self-directed by the people who have the greatest vested interest in where we need to be going in the future. And I know that this isn't something that's going to happen tomorrow, and I understand historically why we ended up where we are, but I do think it is time for us to begin to build a pathway for us to be self-regulated and lead towards a kind of independent practice, much more so that's going on in other countries. And I understand all of those countries are smaller and have a different delivery model, but it doesn't mean that with all the great minds we have here, we can't begin to go on the correct road in the correct direction. Just like you said, who should help create these position papers on the role of free open access? Who should do it? It probably does have a role from multiple sources, but that just again speaks about the fragmentation that we suffer from so greatly in EMS.
Yeah, even without the ability to practice independently, there are some things that can be changed. So for example, delayed sequence intubation. So administering a dose of usually ketamine prior to paralysis to allow you to appropriately oxygenate a critically ill patient before intubating them. That's something that I don't really see as a practice change, requiring independent practice. That just simply requires a minute or two delay between the administration of sedation prior to paralysis for intubation. Something like that can be easily applied without requiring independent practice. So there's definitely some things that can be done that aren't too hampered by the model. But yes, overall, it is very different being an independent practitioner in the ER as opposed to being a paramedic working under a license and a set of protocols.
So my bad, but I didn't pull that. That is one reference I really should have pulled, which is the Emergency Medicine Residency Directors, the CORD, I guess the Council of Emergency Medicine Residency Directors, that position statement. Do you, are you familiar enough with it to say what kind of guidance do they provide? Is it about quality? Is it about what should be used? I mean, how specific is it?
I'm not familiar with the whole text of it. It does say that there should be the introduction of foam into the curriculum. It also it supports the use, so residents have 5 hours a week of required didactic time. They do support the use of eliminating one of those hours to be done at home through asynchronous learning, as long as there's a way to track to ensure that it's actually being utilized. So those are the two key things that I remember from it, if my memory is working correctly.
Yeah, and you mentioned asynchronous. I just started doing some fully online teaching in the summers, And one of the things I've learned is, the tools like Zoom and other conference programs allow you to do live lessons as well as the asynchronous. So you can set up, modules and begin with a live lesson, and it can be recorded, and that way there's at least a classroom model, so that people can have the option to interact or to watch it later, or I should say, or watch it later. And then you can post things like, Khan Academy videos and text and guidance and to-do lists and things that will guide a student through. There's also things like programs, early alert systems like Starfish and others that are that you can use to alert students and ping students that are not maybe engaging in the material as much. So it's all about, helping students become better self-regulators, and we know if they're better at self-regulated learning, then they're more likely to succeed. So I think that how to integrate some of these resources into that and weave into asynchronous and synchronous distance education, that's, I think, a statement worth making.
Absolutely.
So any other, what about any other limitations or anything else? Where would you go from here?
Well, definitely, the limitations that I mentioned in the paper, the small size, the small number of responses definitely limits what you can take away from this. A bigger study may be necessary, but I think that the take-home point is pretty clear that, there's definitely room to grow for the use of foam pre-hospitally. And that's really what I would like to stress, is that there's definitely a role for foam in EMS education.
Yeah, any comments or questions out there from listeners, you can type them into the question box too, if you use or if you have resources that are other than ones here, or how you feel about, getting a guiding document or something that provides some type of guidance on it. I know the National Association of EMS Educators is working on the next edition of the educators textbook, the Foundations of EMS Education, the next version of it. And I know a lot of the distance education and other aspects of individualized learning will be included in this textbook, including the distance education and foam resources, and how maybe some guidance on how to utilize this in the classroom. So that's one thing, but maybe you have some input on how to use this, or how we should move about making a general statement about this, and because it is an important resource, and I think it's probably something that we should discuss as whether it should be recommended for incorporation, and whether it gets implemented into a accreditation standard, or if that's a little too much, and whether it should just stay as right now a position statement or recommendation from national organizations.
Starting with the bottom up, I think a position statement is probably the right way to go.
Yeah.
Yeah. And I wanted to add in there, I said, NEMSI could be really radical, and the next educator resource manual could be a free open access manual. And
that would be great.
Something that is a living document that could be changed and updated, and have a greater peer review thing. And if they wanted to make a small, that it's free to members of NEMSE, and then maybe a fee for non-members. But I would like to see it done in that format. If you really want to put your practice to work, you should demonstrate it by doing it.
And that's probably maybe a little bit of the idea behind Domain 3, but I'm not sure that that's taken off as much with the regularity as you're talking about, or with the the living document part of it, the input and from all different educators around. Okay, Sean, did you have any questions or comments?
I just want to say that this was a great piece of research to read as well as review, and I'm really appreciating the fact that we're discussing free open access medical education on a podcast, which is free open access medical education, and I just think that it's pretty meta. So thank you for the opportunity.
our youngster in the bunch. Meta. That's a new one on me. It's pretty meta. You heard that, right, Bill? You knew that term.
No. And I'm the oldest on the podcast, I think.
Yeah. So, Bill, do you have any final questions or comments about the study or for Dr. Bucher?
No, but I want to thank you very much for having the foresight to conduct the study, go out and have it published and everything. And I thank you for contributing to the greater body of understanding or lack of understanding that EMS has about a very important topic. And I just thank you for taking time out of your day to come and speak with us. I greatly appreciate it.
And I definitely appreciate the opportunity. This was great.
Yeah, thank you very much. It's always much more enjoyable to have the researcher on. We can ask questions rather than make assumptions. And we welcome you any other time. And good luck in your future research and your future efforts. And if you could advance to the final slide, because I have not memorized the dates for our next podcast. Yes. So thanks everyone for joining us. Please join us next month. And we actually have a great new year, safe new year. Remember that we are an education research podcast on the fourth Fridays, and the next fourth Friday is January 25th, 2019. And remember that we also have our clinical podcast. That'll be coming up Monday, January 14th at 10 a.m. Pacific, noon Central, just like all of our podcasts. And we really thank you for joining us. And we will see you next time. Happy New Year.